Greetings, Dr. Bill. My name is Alec Maxwell, and my fellow associates and I will correct some of the fallacious statements that you had made on your previous show. Hopefully, we can cast a saving throw in your direction and return some of the credibility that you lost due to your lack of research. So, let's start with the origins of heroin, not historically, because I don't have an hour of my life to give to you, but the actual biological source. Heroin comes from the opium plant, and how it is extracted is it is separated from the seeds, really quick, or the bulb. And so what happens is the plant has two byproducts, very delicious and overall harmless seeds, or poppy seeds specifically, and the morphine and codeine-rich sap. And so how they extract the sap is they score the surface of the plant, or the bulb specifically, and the sap oozes out, and they let it dry in the sun. And then once that sap has been dried, it is extracted, and then, oh Jesus, what did my wife say?
Oh.
She had the...
Is it extracted? Then you could just say is used for byproduct of heroin.
Oh, it's used to create heroin, but there was like a specific thing that she said. It was like acetic something. Cut that piece out too. But, and so the sap itself is then converted into heroin through the mysteries of science.
We're in psychology class.
Exactly. The mysteries of science. And so... Once the heroin reaches its consumer and injected into the body, it attaches itself to tiny proteins at the end of nerve cells called receptors. Specifically, the mu, the kappa, and the delta receptors. Primarily the mu because they are the most abundant. When we all talk about heroin vaguely or make jokes with our friends or colleagues or your show, we say things like it attacks the brain or it inhibits functions within the brain. That is incorrect information. Heroin is a prodrug. Heroin itself doesn't make it past the initial injection site. What it does is its byproducts will then travel through the system. Hopefully you can see this. So here we have the morphine. So two of its byproducts are morphine and 6-MAM. And what that is 6 monoacetylmorphine. So consider it like supermorphine. There we go. So there's an example of that. And so when these two products get into your system, they attach themselves to, or they seek out three major systems. The limbic, the brainstem, and the spinal cord. In the limbic system, it causes feelings of relaxation, euphoria, EU for short, pleasure, and contentment. And that is the cause of the addictive nature of this drug, because of these positive effects. When it is in the brainstem, it attacks acute pain. So instant relief. And then when it attaches itself to the spinal cord, it attacks pain in an extended manner. So pain over time is relieved. And so I'm going to hand you over to my fellow colleague.
Hello, I'm Taylor. I'll be talking about why the addiction to heroin is so strong and different treatment options for addicts. So according to NIDA, receptors for heroin are located in the brain, like my colleague explained just a little bit ago in more scientific detail. But when heroin is used in the human body, basically what happens is those portions of the brain that control the reward center are infiltrated with heroin, and it's replaced with numbness, no pain, no discomfort. So what happens is that your nerve receptors go into overdrive, meaning that they exhaust themselves. And the moment that they're exhausted and it starts to die off and the brain cell doesn't have that heroin to replace the numbness, the person has an urge to shoot up again or smoke or take the pill orally, however the heroin is used. Basically, over time, this becomes such a strong addictive property because your brain cell doesn't know how to function without it, which causes people to believe that heroin is one of the strongest addictions out there. And it's true, because also after one use of heroin, you tend to become immediately, those brain cells are immediately exhausted, meaning you have the urge to use over and over and over again. For heroin addicts, it is extremely hard to overcome the addiction. Now, doctors, therapists, and scientists have found that behavioral treatments along with pharmaceutical treatments are the best ways to overcome the addiction. Starting with behavioral treatments, there's multiple ways like the 12-step therapy, continuous management, community reinforcement, and also just rehabilitation treatment centers. Now, depending on the severity, where you stand, how certain treatments affect you, that's up to your doctor's discretion. But the three most common pharmaceutical drugs that are used to help addiction for heroin is naltrexone, methadone, and I'm going to butcher this, but buprenorphine. So, methadone and buprenorphine, those two are sometimes viewed in a limelight of a substitution for heroin and not necessarily a treatment, but it really truly is a treatment. They have opiate in them, and they're considered more of a weaning off of the drug, but they both are synthesized. They don't produce a euphoria feeling. They basically block the receptors, but they don't allow the pain to set in. So that's something that is viewed, in some cases, not necessarily the best interest for a patient. Now, next, naltrexone is the most common and has been used for many years, and it has been proven to be one of the best drugs to have, including the treatments with behavioral and other drugs. But what it does is block all opiate receptors from binding. So it doesn't release, it's not addictive, it doesn't have any potential to be addictive to a patient, but yet it's effective because it doesn't allow your brain cells to be exhausted and crave those urges. It completely blocks it. So along with these drugs and the treatments of behavioral centers and therapists and your community, the addiction can be overcome, but it is a long, treacherous road, but it is reversible.
Hello, Dr. Bill. My name is Bernice, and I wanted to talk to you about drug tolerance. In America, the rate of opioid overdoses have tripled since 2002. In fact, more than 100 Americans died every year from drug overdoses. And you see, we would think that it would be from high dosages of heroin for heroin users, but that's not always the case. Overdose typically occurs in long-time users who should have dealt with it, and they seem to have a tolerance rate for it rather than people who just started out. And also, autopsies often don't reveal high levels of drug in their system. The reason for this happening is people, when they build a tolerance for heroin, let's say I was a heroin user and I, let's say, shoot it up all the time at, my local drug dealer. And every time I go and I get high, like my body knows, like, okay, this is happening. This is how we're gonna fight, like towards like the heroin, because it's the place that I'm usually doing it at. Your body like gets used to the surroundings, maybe the people, depending on like where you do this at or who you do this with. Your body basically taught like learns how to tolerate the heroin, and basically it knows like it's time to, okay, like fight this out. But what happens when, let's say, you go out of state and you want to get high, and then like you're looking for someone else, and once you like get high somewhere else, let's say at a park, and then like everything changes, your body changes, it knows what it's going to happen, but because the surroundings and everything else is different, it doesn't quite know like how to react. Like it's almost like if it forgets. And so this is typically why we have people overdose. It's not just because of the high dosage of drug tolerance. Um, Increasing its dosage may re-amplify the drug effect. However, this may accelerate tolerance further, reducing the drug's effects. I don't know if you guys have seen a 2020 report by David Muir, and basically he follows a drug addict who always shoots up in his house. And basically the background story to this man's life is he he's trying to look into a rehab place where he could go and get help, but it's really hard for him to get in because it is an epidemic and a lot of people are trying to get through, and it's like a whole mess. So after all, like he finally gets in to like this rehab place, and he has like 3 days until he goes and like tries to get better for him and his family. But before this happens, you see him take in a bigger dosage than usual, and after all, he's fine. But later on, 2 weeks when he's into the facility, he decides that he really needs the drug. And as he goes out and looks for like heroin, he finds someone that could give that to him. And next thing you know, unfortunately, he had passed away. And this is a lot how it works, as this man would always do this at his house. His body knew how to react and how to fight it, but once the scenario changed, that's why he overdosed. And that's how our bodies work towards tolerance. So most of the time people pass away not because of the high dosages, but because of the surroundings and like how the body will respond to it.
Thank you, Dr. Bill, for listening to our presentation. Hopefully this clears up any misleading ideas about heroin and how it affects the brain and body. I want to thank my colleagues also. I think they did a wonderful job, and I hope you enjoyed it.